Okay.
Hey everyone, we're just allowing a couple more minutes or another minute or so for everybody to join before we get started. We appreciate y'all being here tonight. All right, we're going to go ahead and get started tonight. We appreciate everybody for being here. It's great to see some familiar names. We really appreciate y'all for attending. Today's webinar is titled Getting to Zero, Engaging the Homeless Community, and brought to you by Proactive Community Services in collaboration with AIDS Foundation Chicago and Illinois Department of Health. Proactive Community Services, or PCS, was founded in February 2005 by an African-American woman who saw a need to close the widening social and health disparities that severely affected African-Americans. PCS is a minority-serving human service organization located in the South suburban community of Flossmoor and provides comprehensive services to 28 South and 5 Southwest suburban communities. The agency's service portfolio includes health and wellness and workforce development and supportive services. During this webinar, PCS invites faith leaders, community advocates, and other individuals interested in reducing the rate of HIV, STI, and other communicable diseases in Black and Brown communities to join this conversation facilitated by Al Forbes, MBA of Forbes Consulting, Minister Oliver W. Patton Jr., MSP of Love Abide MB Church, and Pastor Charles Strait of Faith United Methodist Church, with guest speaker John B. Perkins, Street Outreach Coordinator of SSPADS and Aunt Martha's. We encourage you to please join us next week for our webinar, Getting to Zero, Engaging Trans Women of Color with Zahara Bassin, Thursday, May 26th at 6 p.m. Central. You can also view recordings of past sessions on the PCS website at pcsil.org by navigating the past webinars in the events and webinars section of the homepage. Please continue this and other conversations on ending the epidemic on Facebook. As a reminder, your cameras and microphones are set to off, so please write your questions and comments in the chat box, which we will be monitoring. If for whatever reason you would like to come off mute to speak with our speakers, please raise your hand and I'll give you the floor. Also, PCS is looking to get more speakers for future webinars. Please send information for potential speakers to GTZ, Getting to Zero GTZ, webinars at pcsil.org. And finally, as a disclaimer, the views and opinions expressed in our discussion are those of the presenters and do not necessarily reflect the official policy or position of Proactive Community Services. All right, thanks for bearing with me, everyone, as I read through my script. We're going to get started tonight. I'm going to ask each of our speakers to introduce themselves for any new attendees we might have tonight. I'll start with you, Minister Patton.
Hello, everyone. Good evening. My name is Minister Oliver Patton, and I'm on the ministerial staff at Love Abide Missionary Baptist Church. And I'm glad to be here in another session of Getting to Zero.
Pastor Strait, would you like to go next?
Thank you. My name is Charles Strait, and I am the pastor of the Faith United Methodist Church in Dalton, Illinois, and a organizer and board member with the People's Lobby, a grassroots organization that is dedicated to ending racism.
All right. And John Perkins, would you like to introduce yourself?
Yeah, well, good evening, everybody. It's a pleasure to be here. My name is John B. Perkins, and I provide street outreach services for South Suburban PADS and at Martha's in conjunction with the Alliance to End Homelessness. I've been in social services up for over 20 years, really engaged in getting to zero in terms of homelessness in the South suburbs. And it's going to be a pleasure speaking with you tonight.
Thanks so much. And Al, I know you were having some technical issues. Are you able to hear okay? Can you introduce yourself?
Yes, I can. Thank you very much, Andrew, and welcome to all the folks out in webinar land. My name is Al Forbes. I'm a consultant with Proactive Community Services, and I'm really happy to be here. We're going to have another lively conversation this evening. We've had two already, one talking about getting to zero and some general conversations 2 weeks ago, and last week we had our faith-based leaders who spoke about getting to zero in regards to faith-based organizations. Tonight, we take a look at homelessness. And I really want to jump right in with John, because I think that sometimes we have a misunderstanding of what homelessness looks like in 2022. I think that some people may have an idea, John, that homelessness are men who are either drunks or drug addicts, who have low functionality, uneducated. There's a whole lot of myths about what homelessness looks like. And so before we get going, why don't you share with the audience about what the homeless population looks like in 2022 that you find yourself dealing with in the South suburbs?
Definitely. So I'm a part of a coalition, Continuum of Care, along with the Alliance and several other agencies in the South suburbs. But let me just give you some statistics. On any given night in suburban Cook County, 846 people are experiencing homelessness. There are 728 people staying in emergency shelter. Right now, South Suburban PADS and Beds Plus are housing the majority of them. There are 118 people that are unsheltered. Those are folks that are sleeping at the bus stops, sleeping in abandoned buildings, sleeping in their car. And on a given night, there are 80 youth and young adult households experiencing homelessness. This is the 18 to 24-year-old population. So that kind of tells you what's going on here in the South suburbs. But collectively, our agencies, our mission is to end homelessness in suburban Cook County. We believe this is possible through cross-sector collaboration and data-driven decision-making. And through this continuum of care, which is a diverse network of partners working together to develop, fund, and implement solutions, we will end homelessness. We try to go out and we try to build stakeholder relationships with philanthropic community, policy and advocacy organizations, healthcare providers, community-based organizations, homeless service providers, affordable housing developers, school districts, the McKinley-Vento Act. There's quite a few homeless under the age of 18 youth in our school systems, and also our local, state, and federal governments. Now, let me explain the continuum of care really quick. This is a coordination of through HUD. HUD allocates about $13 million annually to the Alliance to End Homelessness. And then they disperse those dollars to the agencies that are a part of the continuum, okay? So my job is street outreach in the South suburbs. So I'm gonna tell you a little bit about it. Street outreach is the first point of contact, typically, when it comes to engaging the homeless population and monitoring the call centers. There are two call centers that I monitor. One is through the Alliance and one is through Aunt Martha's. And that is a call center that deals directly with the youth population. Now, what happens is when we get those calls, we respond. So we'll respond by contacting the caller, or we'll go out and have to engage. And when we do this, there's assessments that we have to complete, right? To help us better determine how to refer those people and get them to shelter. It's been very challenging since COVID. Let me tell you that, because a couple of years ago, the shelter structure and system in the South suburbs was congregate. So there was over 16 churches, you know, volunteer based that we worked with, that we could accommodate as many homeless in one night as there were out there. But because of COVID, the structure changed and we had to go to a hotel-based system, which has created wait lists because, of course, using a hotel, it costs money. So HUD has provided money through the CARES Act to actually supplement those shelter slots, but it's created a wait list. So for me as a street outreach case manager, my job is to get people to shelter. It's been very frustrating because there's a wait list now. So we've kind of taken the emergency out of shelter. In the South suburbs last year, we serviced 10,600 people through the continuum of care system. That's a lot, you know? So I don't think people really understand the impact, you know, that the policies that have been made throughout the years that it's impacted the homelessness population. There's been a cut in mental health funding. You know, there used to be facilities that would house and assist if you're going through a mental health crisis. Well, that no longer exists. So, of course, we see the increase in our prison and jail numbers as well as homelessness. Through our call center in 2021, we had over 2,700 calls, okay? Out of those 2,700 calls, we provided 1,676 referrals. So that was getting folks to shelter or getting them housing assistance. And we also work with the at risk of homelessness. So if you, let's say that you are in your home and you're about to be evicted, or you're behind in your rent, or you need utility assistance, we have some homeless prevention funds that will assist. So we serviced about 1,676 calls last year. We got about 200 calls that were out of service area from Chicago and Indiana and other places that we supported. We provided information to over 241 folks that called in and got them diverted and the assistance they needed. We also assisted in about 300 more calls if it was errant calls or the client actually self-resolved, or it was just follow-up inquiries. So we've serviced quite a few people in 1 year's time. And it's amazing because I don't think people actually understand the impact of homelessness in the South suburbs. Let me give you some other statistics. Within those 1,745 households in shelter, there were 195 shelter nights. There were 585,000 meals provided. So there's a lot of work going on out here from volunteers and from churches and from anyone that will support ending homelessness in the South suburbs. We also launched a youth demonstration project, and Aunt Martha's actually facilitates that program. One thing I like about my job is that when my team is monitoring the calls from the call center, I have the ability to disseminate the appropriate referral. So if I get an 18 to 24-year-old youth, I will send them straight to Aunt Martha's. But the problem is that Aunt Martha's only has so many emergency slots available. So we kind of rely on some of the other CLC partners, such as South Suburban Pads and Beds Plus, to be able to shelter those folks. But like I said, it's been challenging because of COVID. And now we have a different shelter structure. But this youth homeless demonstration project is great. They have transitional housing, they have rapid rehousing, and they have permanent supportive housing. So what that does is that they're giving the 18 to 24-year-old population a leg up in terms of getting stable and becoming self-sufficient. The project is coming to an end, but it's been very successful over the last year. So another thing that I want to say is that in the south suburbs of Cook County, we receive more calls than Chicago does in terms of looking for assistance. You know, so that lets us know that we do good work out here in the south suburbs, but the need is also there. And I
John,
think
can I?
Thanks, John. One of the things I want to just have you also speak on, and I'm going to open it up to our pastors because they're part of the solution, as well as PCS staff and members. Can you speak to, because we all saw Will Smith's Pursuit of Happiness, and we saw him with his son out there in the homeless situation. Can you speak to families and what that looks like in the south suburbs? Are you seeing a lot of family units that are homeless and struggling to get by?
definitely the majority of the households in shelter are actually families, and not just single women and children. There are quite a few single men with children in shelter. The problem is that with the hotel system and the structure, we get big families, large families, 7, 8, sometimes 9 kids. So that's kind of hard to shelter in one room. So what we've done is that we've collaborated more with Illinois Department of Public Health, with the city, with the Housing Authority, and they've created a voucher system, EHV vouchers, which houses families faster. So we're expediting getting them into a permanent placement. But there are more families in emergency shelter than individuals.
John, can I ask you also, this is Reverend Strait, what kind of support are you currently getting from the faith community? And what would be the kind of support you would be looking for? And that is just kind of a part one, because I believe in activism. I believe in moving elected officials to seeing the need that's in front of them, even when they have different priorities. And so I believe that there are ways that we can act in order to make change actually happen for people like you who are working on the ground. So can you tell me what kind of support you're getting from faith communities? And then what can we do that can actually move the needle toward funding, toward resources, toward making the life of people who are homeless better?
Sure. The majority of our volunteer base are the churches. Okay, so we appreciate everything that you do. The meals that I talked about, the 585,000 meals that were provided, it came from the faith community. The donations we get for clothing comes from the faith community. A lot of the volunteers that come out and hold service at the shelter, at the hotels, we appreciate that. I think what's needed is that we really need to get away from the hotel-based model. Hopefully, this pandemic is ending. I'm praying for that. And we need to get back to more of a congregate structure, just because we cannot service the need. I feel bad every day, and I'm actually waiting for a call to see if there's a slot opening up at the hotel for this young 24-year-old who is actually in a CDL program. And I got a call from his instructor saying that he's a really good student and he's about to graduate and he's going to go out on the road. But we had to address his hygiene issue. So when she had a talk with him, he's sleeping in his car, been sleeping in his car for the last 4 weeks. So she was like, can you please get him in shelter? So I am actively working right now, hopefully finding a bed for this gentleman tonight. That's our struggle. So I think there needs to be a collective conversation with maybe this panel and the Alliance, just to talk about next steps in terms of getting back to normal and providing emergency services.
Thanks, John. As we enter this discussion, now that we have a good idea of who we're talking about in terms of who the face of the homeless, what that person looks like, what their situation might be. Can you speak now to the intersection with HIV, STIs, HCV, and other infectious diseases among the homeless population?
Yeah, it's actually pretty tragic. That's the most vulnerable population right there. Those are the individuals that are typically unsheltered because for whatever reason, they're hard to engage. Proactive has been a blessing over the last year. We've done several events together, community events on the surrounding south suburbs, providing education for this population. But they're the most vulnerable, and I think there needs to be a greater effort in terms of engagement and making those individuals feel comfortable to step forward, because they're in need and they deserve service as well. And we want to service that population, but it's hard because they are the most vulnerable. They're dealing with more crisis than the typical homeless individual. So it's a good time we're having this conversation because that population is growing in the south suburbs, and there's just not enough support to actually service.
Hello, John. This is Minister Patton. And what you just said is true. On the outreach of those that are homeless and have HIV, what is the process of approaching them? Is it done in a setting where they're coming to talk to them, or is it done in a sense of way of trying to tell them, okay, you need to go get tested, you need to do this and that? Or would it be better if it's a faith-based community with the churches can get involved and do an outreach with you going into the areas where they are?
Definitely.
Would that help?
Yes, that would help. Some of the efforts that we have provided over the last year or so is that we provided quite a few health fairs, vaccination events, and got flyers out. Pastor Straight, his site was key in this as well in Dalton. We appreciate that. But getting information out that will allow those individuals to feel safe and to feel like that they're going to be heard and without risk. So getting out into the communities where they are is definitely key. Passing out literature that they can read and understanding where to come without feeling threatened. So there needs to be a more collective effort with the faith community and the other agencies just to get out in the community and spread the word.
Okay, yeah, because I was wondering when some people are presenting to them, how they present it to them, because when you're presenting to people that are in that area and that vulnerable, the way they perceive it might not be the way you're presenting it, and they take it a different way.
Sure. You're exactly right. I mean, we have to be, it's very delicate, I think, they already feel like that they're being ostracized, and we have to overcome that stigma. So as I said, if there's more collaboration between the faith-based community and the agencies that are out providing health fairs and other events that are more welcoming, and providing information on literature that gives direction to what it's going to be, what's actually going to happen if they come. Turnout is key. It's hard to get folks to come out sometimes, but we have to be very persistent and trying.
John, I also want to jump in and say too that we're not talking about just a few people. I was reading some literature from a national homeless agency that says that the population of HIV-infected homeless people is as much as 3 times higher than in the national average. So amongst a homeless population, there's a 3 to 4% population of people that are HIV positive, which is then, as much as 3 times higher than the national average. That's a lot of people, considering there's over 3.5 million homeless people in this country. So we're not just talking about, a niche group. We're talking about people that exist within a stigmatized population that is then stigmatized again because of their their HIV status. And it calls us, that people of faith, to realize that we have got to address the issue of stigmatizing in whatever form it comes in, whether it's because of economics, whether it's become homelessness or addiction or HIV or LGBT issues. The issue of stigmatizing must be addressed within the faith community if we're going to do the work that we are called to do. When Jesus points out in the New Testament that I was homeless and you didn't take me in, he's specifically talking about the outreach that the church must do to this population of people that you serve. And I think the list just goes on and on of how we have been mandated by God to do this work of making sure that folk who are, for whatever reason, find themselves without a place to live are accommodated. But I don't want to just stop. And I'm so glad to hear you say that there's so much support from the faith community, but I don't want to stop there. There are so many, the AIDS Foundation of Chicago and organizations like PCS rather, that is doing this great work to address the issue of HIV and getting to zero, especially amongst the homeless population. That's fine and good. But what about funding that comes on a federal level, or funding that comes from the county, or funding that comes from the state? How do we work harder to make sure that you guys can do your job more effectively? Because everything, depends on money.
Exactly right. I totally agree. And what discourages me also is that I think the pool of money that is allocated for the homeless, it's just kind of thrown together. We stopped identifying the issues within homelessness that we're discussing now. And we can't do that because, HIV, mental illness, substance, the main reasons that home, when we fail to address, all we're doing is continuing the process, because we're not addressing that. We're not assisting folks that are suffering with HIV. We're not assisting folks that are going through a mental health crisis. We're not assisting folks that need to go to substance abuse treatment. It's kind of being all lumped together, sadly.
I want to take a moment to go through some stuff that we've had come up in the chat. Eula had wrote, homelessness also puts individuals at higher risk for HIV infection and other diseases that adversely impact Black and brown communities. And we also had a question too from the chat that I'll post to John. When you spread the word to help, but there is no housing, right? Then what?
I'm sorry, repeat that one time. I got that call in and I was looking at my phone. Say that question.
No problem at all.
Yeah.
Someone had written, when you spread the word to help, but there is no housing, right? Then what?
Yeah, that's a major issue. I mean, I think that we get calls all the time that folks feel like, and everyone deserves a home. Everyone deserves a home. And when they hear that there are programs out there that are supposed to help them get housed, we have to educate them that there's still a process, and there's still funding issues. There are issues now with finding good landlords. the moratorium's over, and landlords do not want to work with agencies like ours, and our population sometimes. So right now we're struggling to find units to put folks in. So it's very difficult. We've got challenges, sitting over our heads, and questions that are being asked that we can't answer. And I think that it's the time to do that, to time to have these discussions, because just throwing the money that HUD throws at our continuum right now without addressing the challenges and concerns that us, the folks that are on the ground, experience every day, is a mistake. Okay, it's a mistake because we're not helping our population, our homeless population. All we're doing is recycling.
Yeah, I think we need to also address, and you can speak more to this, John and I, but I think we need to address the perfect storm that is created because of homelessness, and because we have our LGBT community, we have our mental health community, we have our substance using community, we have our sex working community, we have people who become homeless because of COVID and other circumstances out of their control, loss of jobs, evictions, etc. And they then fall into substance abuse, mental health because of depression. And we all know that sex work is probably the easiest thing you can do when you are desperate and need money or need a place to stay. So you have both the cause and the response all kind of circulating amongst that community, and put the community at greater risk. As Eula mentioned, that Black and brown people who are homeless are at greater risk of HIV because they are now potentially using drugs they didn't use before. They may have mental health issues that they have not been addressed before, not being addressed. They may be sex working for the first time. So all these things come together in that perfect storm to create a real problem when we talk about homelessness. And I think we can't overlook that some of the people who are homeless are very high functioning people who just missed that last paycheck or that rent payment and found themselves in a precarious position.
Sure.
So it's a very mixed group of people we're talking about.
Definitely, totally agree. And our communities get hit worse with everything, and our communities, we're the first to get something taken away from us, right? We talk about the food deserts. We talk about the lack of after school programs. We talk about the lack, and back in the day, to keep communities together, those were essential programs in Black and brown communities. But it seems that over the past decade, they continue to take from our communities, right? And with the lack of education, jobs, poverty, I could go on and on of what's happening in Black and brown communities when we're dealing with mental illness and HIV and all these things we're discussing. It just gets evaporated. It goes on and gets larger and larger. You see it more in our communities. That's why if you ride through some of the communities in the South suburbs, if you ride, and I can name those communities, but I'm sure that you know them. It's like a war zone, and it's like nobody cares at times. You see folks walking up and down the streets, and abandoned buildings, abandoned homes, and there's nothing around, right? So our communities are affected twice as much as any other.
I'll weigh in too from the chat. We had a comment from Eula that you're absolutely correct. The taking from our communities is profound. And we also had another question too. Is there still stigma in finding housing for HIV folks?
Yes, definitely. We deal with this housing first model, which it's a great model, which essentially states that everyone, regardless of your situation, you deserve to be housed. But it's getting landlords to actually buy in to that, right? And a lot of times when we're going out, trying to find housing for individuals, we have to answer a lot of questions, acting as liaisons for housing. We have to answer a lot of questions from landlords because they want to protect their properties. We understand that, totally understand that. But, and we can't divulge certain information, and we don't, but, streets talk a lot of times, and, it just creates more barriers for us. And we've even had situations where landlords have taken in, our participants, and 3 months later trying to give the rent money back because they don't want to house them. So there's all sorts of barriers that are created because of the stigma surrounding HIV, mental illness, and others.
John, this is Minister Patton. I have a question to wrap up into there. Would it be better for your organization in that setting and some of the faith-based community leaders and churches that are in the southern suburbs to do like they do towards the west side and up north, where the abandoned buildings that are sitting? Is there a way that there can be a meeting brought to the table where they can get together and approach some of the aldermen or the mayor of the town, or even go to the banks and see if they can give that building to the church and let the church open it up as a housing for HIV or something like that? Is that possible that a meeting can be set up for something like that? Because I think that would help.
Definitely. And I think there was some conversation stemming around that about a year or so ago. I know that at one point, Harvey, the mayor, you could go buy some of the boarded up homes in Harvey for as long as you paid the taxes on the home, you could get it, and the taxes probably weren't that high, so there's opportunity to get, abandoned homes, to facilities that are boarded up. A lot of times, municipalities will give a building for $1, but I don't think there's enough organizations stepping up anymore. I'm talking about the social service agency. So yeah, that's an opportunity for the faith-based community to come in and support, and maybe we can collectively come up with more facilities to house folks.
Okay, that's good, because what I was thinking about in that case where it's brought the basically in the community and the pastors of the churches, when they come to that table and they're at the table and they're going through it, and then who knows, there might be somebody in that congregation that might have some type of leeway to a property that's abandoned that they can get to, or somebody they know, a realtor or somebody they know, that say, well, hey, we have this problem with HIV people that they're homeless, they can't find a home. What can we do to help? Because you have people in the community that want to help, but they don't know who to go to or who to turn to, or any numbers of how can we help or who can we call.
Definitely. And I would love to come out and to any of your churches and just talk about ways that you can help and maybe get your congregation involved. I think that if people don't know, we're just talking in circles. But you're exactly right. I think that within your congregations, there's probably tons of jewels, tons of opportunity.
Yeah, we want to start thinking solution focused. How do we solve the problem? And I think that being realistic, we may not be able to save everybody, but even if we can make a difference in the lives of 10 people or 10 families, that makes a big difference at the end of the day. John, I'm not on my computer, so I can't see the chat, but have you dropped your number into a number that can be called to further discuss with you, or to volunteer or support your efforts? Is there a number that people can reach you at? Sure.
I'll drop all my information before we leave. And
Great.
I'll send any resources and flyers that I have that you might want to see as well.
So I want to encourage people to start dropping in the chat or opening up their chat lines. Just ask Andrew, he'll open up a line for you. Let's talk about solutions. What can we do? What tangible difference can we make? Because we hear a lot of people talking a lot of smack about what other people should do, what the government should do, what IDPA should do, what the governor should do. We hear a lot of that. But now we're in the room right now. What can we do? Juneteenth is coming up, a day that celebrates the freedom of Black and brown bodies in this country. And it's not true freedom if we're talking about freedom now go be homeless and to be without food, to be without shelter or without education, without a source of clean water. We have not reached freedom. So as we approach Juneteenth, what can we do as a community? What can we do as individuals to make a real difference? Besides, as we might say in the community, flapping our gums and talking about solutions. What can we really do? And I'd love to see the comments fly in the chat room, or people open up their mic and speak truth to power about what can we do as churches, as CBOs, as individuals. What can we do?
Yeah, and I'll weigh into with some comments we've had in the chat. Eula wrote that homelessness is a problem where it takes the collaboration of partnerships with faith-based and community-based organizations. Ron Smith wrote that I think a lot of the people are shocked by the homeless suburbs that are affected. Eula also wrote that you're absolutely correct that taking from our communities is profound. And let me see, I just had another question come in from Eula too, that we need to get together to help fundraising. We also have one more question too, and this is related to the housing that John was talking about earlier. Do they have to disclose their HIV status, John? This was a question from the chat.
No, they don't. No,
Okay.
they do not. And that's an issue I have as well, because you do not have to disclose any of your issues to our organizations or the potential landlord. That's the housing first rule. But it's just amazing how, like I said, how the streets talk, in our communities, how the streets talk. It seems like for this population, everybody seems to continue to disenfranchise because they think they know their business, because the way that they look, the way that they act, or when they've been seen living outside, then that's sad.
And as Al said, if anyone would like to ask a question to our panelists at any point, feel free to raise your hand and I'll allow you to unmute and ask your question of them. But we appreciate the engagement that we've received so far. We appreciate everybody being here.
I'd like to say too, John, that we cannot underestimate the need for persons to speak up to their elected representative, because we cannot bear the responsibility on our own. This is something that we must all share in, and our government on the local level as well as statewide and federal has a responsibility to help us do the work that is needed to make our communities safe, to make those who are disenfranchised brought into the mainstream, and so forth and so on. That said, the only way that we get to that point is that we too must be a part of the solution, like Al said. We cannot just expect that somebody else is going to solve our problems for us. And I think that what that means is that, one, we've got to be aware, we've got to be aware of the problem in our community, and then we've got to want to address it. As a pastor, part of my issue becomes, how do I educate the people in our congregation about the issues that exist not only in the community around us, but the community around us is what makes up our congregation. So if I'm not talking about homelessness from the pulpit, if I'm not recognizing HIV on the annual days when it comes up, if I'm not talking about, like for instance, this month is Mental Health Month. If I'm not talking about the issues of mental health in our community, if I'm not talking about the issues of breast cancer among women in October, and the list just goes on, then the people in our congregation don't have the information that they need in order to become active. So I would actually push our pastors, our religious leaders, our people of faith to say that talking about and educating people, having someone like John come to your to your church and talk to your congregation on Sunday. It doesn't have to be in the service on Sunday morning. It can be after service with coffee or conversation where you can sit around and explain the issues of homelessness in the South suburbs and in the community where we live and where we work. That will make a difference and moving us toward being more active and engaging the problem that we currently have, not only with homelessness, but also the subsets of people that are homeless in those people with substance abuse issues, with mental health issues, with HIV.
Pastor Strait, you're exactly right. We can do it like we did it last summer. You know how we did it at your church. Let's pull out the barbecue grills. You know, that's my passion and my other business anyway. You know, and when we're out in the community and the smoke is flying and we have different community partners that are having tables, just passing out information and providing education. I mean, and making it fun, you know, for the community and for folks to walk in, making it welcoming. I think that's when it's effective.
And I hope you're available on Father's Day / Juneteenth because we want to do it again at Faith Church. And we want to have conversations and talk about the health of Black America 100 years after Juneteenth. So I hope you are available and some more of the folk who are on this call so that we can make it a real collaborative event.
Definitely. Definitely. If I could, I want to touch on a model that I think that's missing that used to be in our communities. As I stated, I've been in social services for more than 20 years. I've worked with the YMCA and all of their SROs, their single resident occupancy buildings when they had them in the 90s, 80s and 90s. I've worked with the Institute of Cultural Affairs in Uptown, a 76,000 square foot facility that housed 36 other nonprofit agencies that had different support services in them, including a residential facility. Those are the facilities that are missing in our communities now. When you have a facility that is a collaborative effort that provides transitional housing for individuals that need it, but they can get services on site, a variety of different services, from HIV testing and education to all the other issues that we talked about. It's a collaborative effort with many other organizations that can have an office on site or at least come into the facility whenever they want to talk with the residents. And that would be an effective way to get individuals into permanent housing. There has to be a transitional piece there that's effective, that's providing a structure of stability for our population to get into permanent housing. We just cannot continue to throw them into a permanent setting without support services. You know, it's just homelessness recidivism.
We had another question come in from the chat, really a couple of questions. I'll start with this one. Can you address how bad the homeless situation is for youth or runaways?
Tragic at the moment. Over the last 2 years, there has been an uptick in my belief, my opinion, in the popularity of substance abuse. And this particular population is indulging in some things that's affecting their mindset. Okay. I get calls daily from police stations or the community organizations, and they have an 18 to 24-year-old that is homeless, but 9 times out of 10, they're experiencing a mental health crisis based off of something that they drank or smoked or both, and it's truly affecting this population. It's turning them more violent, desensitized to anything that's around them. And that's one of my fears when I'm in the streets. I'm never afraid of anybody that's homeless. I mean, they're not a threat. It's it's the younger population that is homeless because they're out there, in my belief, the majority of the time because of behaviors that has affected their mind. And it's growing, it's increasing, and that's why HUD threw several millions of dollars into the homeless youth program that Aunt Martha's facilitates, because we have to address it in some capacity. But again, we need to address the root cause of why they're homeless.
We have one other question as well, and that is, why did the SRO model vanish?
Very frustrating for me because I loved my job at that time. I mean, I used to get to bounce around to all the YMCAs in Roseland and Washington Park and Austin and Lincoln and Belmont and, you know, and New City that was, you know, up north on North Avenue. All the SROs that the YMCA ran at that time. And I don't work for the Y anymore, so I don't have to be politically correct, but I know that those Ys weren't looked at being revenue generators for the overall YMCA system. And I think that, you know, in the late 90s, it was more attractive because the YMCA was also a family physical fitness type of business as well, and they geared themselves toward that. It affected our population, our communities first, because those YMCAs are where were the safe havens. Do you understand? That's where the kids came after school, because they could come to the gym, and you know there was not only SRO, but it was also safe haven for a lot of our public housing institutions that are no longer in Chicago. So our community, as I said, everything's taken first, and it has been affected the worst.
John, I wanted to pose a proposition to you that we can think about collectively as a group of intelligent Black and Brown people on this webinar. It seems to me that there are several levels of people who are in the homeless community. There are the really hard to reach that you spoke about. And if you think about a tree, the high fruit on the tree is hard to reach, but there's some low hanging fruit, so to speak. And that would be the example you gave with a young man who's 24 years old, has really been making efforts to get his license for driving commercial vehicles, and is maybe one day away from being put out of the program because he's going to come in smelling because he can't get shelter in a shower. Is there some way that we can support you and at least addressing the needs of those individuals who are on the bubble, who just need a couple nights of housing in order to get themselves stabilized, or might need to be adopted as such a family or individual and supported through a rough patch, and they would be able to go back in and once again become functional? Is that a model or a proposition that would make sense to you? And if so, how can we strategically plan in terms of doing fundraisers or providing that support for a GED class, for for a month of apartment, for an apartment for a month? That kind of model where we look at not saving the whole world or all homeless people, but really reaching out to those people who are on the fringe and before they get too far into being homeless.
Yeah. There are a couple of things that I feel like that can happen now, and it doesn't take a lot of money to actually to pull it off. I think that we should create a board of some sense that when we have an individual or family that is in need, they can't afford to go on a wait list. So if we had a site that we could send them to, a day site that would allow them to come in and shower and take care of themselves, or a site that it could be rotating, that provides so many beds, because I think on an average every day, there are probably at least 10 to 15 households or individuals that I run into that can't find anywhere else to go. You know what I mean? That they need it right now, and they can't be placed on a wait list, and they shouldn't have to be placed on a wait list. I'm not talking about an overwhelming amount of individuals, but I'm talking 10 to 15 that we engage every day that, like this young man, that he has nowhere else to go. So he can't go stay with a friend. He can't go stay with a relative. Sometimes, our folks are resilient and they figure it out, but just sometimes individuals don't have choices. And we need to come up with some alternatives, a site that would allow someone to come in and shower and get a good night's sleep. We have a volunteer base at a very good volunteer base at South Suburban Pads that we can count on to come out and that know how to run shelter. And we have people wanting to do that again. But there are not sites or churches that are willing to do that right now. Maybe some of the churches on here today on the call. But I can definitely put you in touch with my folks that would provide the structure for running a site like that. And also having some emergency funds for a hotel room, even, if we had like a pot of money, if shelter is full and we can't get them in, like this young man, at least tonight, I think I got a call that there's a slot available at the hotel, I'm hoping. But if there wasn't, there is a pool of money that, we could tap into to get him a good night's sleep and a shower. We just don't have those alternatives anymore. But I think with this group and the conversations we have, and we can come up with it.
We had a question come in from the chat. Does this young man just need a night to get him through?
No, he actually needs 6 weeks. And that's what, if I get him in shelter, that's what we're going to give him, because that's what his instructor said. She said, if he's going to graduate, and we're going to give him a job, we're going to send him out on the road and put him in a truck where he's going to be sleeping in his truck. And that's the jump start he's going to need. He's going to be making some really good money, but he's in class for the next 6 weeks. You know what I'm saying? So all he needs is a place to sleep so he can go to school for the next 6 weeks so he can complete this program. So yeah, that's his situation. But I'm hoping, like I said, I'm hoping that I just got this call and he's going to get a slot in the shelter.
We had some other comments from the chat. Ron Smith wrote that, do they have the bus that comes around and lets the homeless shower? Are they still doing that?
No, we had South Suburban Pads. We do have a bus that used to pick up at certain locations and take to congregate shelter. But because there is no more congregate shelter, we use a couple of hotels right now that are in the same vicinity. So folks are actually have been in shelter. I mean, once they're in shelter, they're engaged by a housing case manager, and they go through a process to get into an apartment. Sometimes it takes folks a little longer. Sometimes we've run into participants that feel like they've been in the hotel for the 6 months. I am housed. They don't want to leave. You know what I mean? So there needs to be some education there to get folks to want to move on, and some confidence that they can have their own apartment, because staying in shelter, a hotel right now is way better than sleeping on a pad during congregate shelter from 7 to 7, but and then you have to leave. So being in a hotel has kind of enabled some of our participants. But the bus, that we still have it, but they don't need it. I mean, because folks are going directly to the hotel.
We had a
John,
comment. Go ahead.
I was going to say, John, could I also ask you a question about wraparound services? So that we know that one of the issues with persons at risk for and living with HIV is being, in care. Can you talk a little bit about wraparound services that get provided for persons who are homeless? So if HIV person has been identified in the homeless population of folk that you serve, the mechanism for getting them into care.
Yeah, so our agency, we used to have a stellar nurse case manager who left us. She went to Texas, sorry. But she was great with that. We always have given priority to anybody that has divulged that, or she did. And she would tap into a lot of the service, but a lot of the wraparound services, to be honest, were in the city on the north side. And there were organizations like Heartland Alliance that were doing some really good work with HIV until Proactive came along. We found them. Ms. Gloria, Ms. Eula found us, and we were able to do more work in the south suburbs. But there needs to be more in conjunction with the emergency shelters and agencies like ours. It needs to be more communication. We're down staffing wise. Right now, we don't have a nurse case manager. So if we do have anybody that's in shelter that, is living with HIV, unless they're engaged at their own doctor, or they're probably not getting the services they need right now. I know that we have Proactive, they come out, and Ron has been great in providing testing and education and whatnot, but it's only one or two people, so there needs to be more money allocated for that benefit. So that's something we can advocate for. I mean, it's just not funded as well as it should be.
Yeah, John, Mr. Patton, what you just said, would it benefit you to search volunteers from doctors that would volunteer to come out, even though Random is out and PCS is out, doing this and that? Sometimes from my experience of dealing with a homeless person, they're more, what I've experienced was they're more calm to deal with a doctor, to come out and talk to them in this sense, to get them to do certain things. Would that help, going into the medical field and asking those to come out and volunteer, even though the funding is not there? But there are some that will come out and volunteer. And, like I said, some people are more calm, and, they'll react more to when it's a doctor talking to them. I'm not going to say besides us, we can give them so much of what we can give them. But from a doctor's standpoint, a homeless person probably would feel, hey, okay, you're a doctor. Okay, yes, I can trust you a little bit more. Would that help, for the volunteer section? No, the funding is not there to actually to pay them or do anything, but to get them to come out and volunteer on their own time.
Definitely. I think of course that would help. I think that we were very effective last summer. We were holding all the health fairs, the vaccinations events, and PCS was actually able to, discreetly approach and gather information and make referrals that they needed to. But having doctors volunteering on site and maybe, I think that it's not as effective if we just gear a health fair for, I think it needs to be diverse to address any situation or anything that someone is dealing with, HIV, substance abuse. I think it makes people feel more comfortable. And if we just call it a health fair, but having a volunteer doctor-based staffing there would, of course it would help.
Yeah, I think we need to be realistic in terms of that when someone has mental health, substance abuse issues, or if they are sex working in order to make ends meet, that person is at greater risk for HIV acquisition based on their circumstances and conditions. So if we can wait till they become positive and then send them to PCS to get a case manager, or we can address the underlying issues so they never have to worry about getting an HIV case manager. And I think that's where the rub is right now, that a lot of HIV prevention dollars are not addressing the underlying causes. And so once you become positive, now we have all kinds of services open and available to you. We have Ryan White that can pay for HUD that can pay for housing, Ryan White that can pay for mental health services or food or rent or utilities. So we need to move to a model that says you don't have to become positive to get resources and to get services. So what does that model look like?
That's a great point. First off, it's hard to say what it looks like, but it has to be all engaging. It has to be accessible. It has to be, I'm sorry, I'm looking at my phone again. It has to be available, and I talked about the SRO model and having multiple agencies there. I think that there needs to be multiple facilities like that throughout the South suburbs, that all collaborate together, but it has to be a one-stop shop that is accessible.
Yeah.
Eula, I saw you had your hand up. I gave you permission to talk. Would you like to ask a question?
Yes, I would like to say a couple of things. If you can't get a doctor, perhaps you could look at a nurse practitioner, because they really do the same things that a doctor does. But one of the big problems that nurse practitioners and doctors are experiencing is the fact that people are asking them for hardcore drugs. And in many instances, they cannot do that. So I agree, we need the SRO, and we need some wraparound, and we need somebody with who can address the substance abuse issue to be there, because in many cases, people get really angry with the providers when they don't give them prescriptions for the drugs that they want. So we have to have something to combat that, because we don't want to put providers in harm's way with regards to people who have substance abuse issues and just feel like that they can get drugs from the medical community. So that's a big issue that we also have to address. And I know that I learned a lot about SROs in my master's program, and they were working really well. I think Alliance had one up north, and it was working really well. So we can get back to some of the other models that we used, and especially have the wraparound services. And at one point, we was trying to look at the building in Matson that someone purchased because the village wouldn't let us have it. But we was trying to use that building to actually have a lot of different nonprofits in there and have the wraparound services, but that didn't happen. So if at some point we can all get together and see if we can advocate for a building where we can have on-site care and wraparound services, maybe that would be helpful if we could figure out how to do that collaboratively.
Totally
And
agree.
that's it. So what's your thoughts about that, John?
I totally agree. And I think there's been a model out there, there's been a model out there that was successful. And that's why I was so frustrated about why, those models got discontinued and funding was lost. But, we can look at those models and make them better and critique them for our communities of what's going on today. And I don't think that it would be very hard to get everyone at the table to discuss next steps. There's so many resources in terms of between all of the agencies now and faith-based community. There's so much leverage that we could use to press this issue and possibly get it done. And there are some politicians that I know personally that would be willing to get on board as well. But I think that getting everyone at the table would probably be the next step.
Yeah, I just here thinking, John, is things because we are all privileged in our own right, in our own way. Many of us have a home to go to tonight and a bed to sleep in tonight. And that in it of itself is a privilege. And we'll have a good meal before we go to bed tonight, another privilege. And I just think about the simple things like being able to get up tomorrow morning and take a shower, how it allows you to feel reconnected to the world around you. And so how can we afford those privileges to some of the homeless community where we can create a space that does have, as Ms. Eula was talking about, wraparound services? And one of the things you can do is come in and take a shower and really just get some clean clothes and feel like a human being again, because I think that's half of the issue, is that I would imagine low self-esteem is prevalent for many people who find themselves homeless, especially those who have not grown up that way. They grew up in a family model with a house and with children around them and adults around them, and now they find themselves in a situation that they may feel less than. So I think looking at those simple things, how can we plug into those things? And I think even for a day, 2 days, 3 days, 5 days a week, that we can support individuals or families to get back to a fresh start.
Yep. Yep. I agree. I think there's a lot of things that we need to think about. In terms of access, locations, that was the beauty of a facility, excuse me, a facility like the old YMCA's, just because individuals could get everything they needed in terms of healing their spirit, mind, and body. Okay. Physical fitness there, if you felt like that you wanted to, get some of that tension out by working out. There were showers there. There was a bed for you to sleep in there. There was counseling, on site. There was just an array of different services, and the model was there. It was there, and I think that once we continue to talk about this, we just need to incorporate having a facility and site that could also support families, large families that we were talking about too. So that's more an apartment setting as opposed to a single room, but a facility that could be all encompassing, so you just got my mind racing now. We just need to write all this down, and start building the plan and our model. But I think that it could help sustain our communities and address a lot of what's happening now, because there's a lack of service. Everybody's out doing their own thing, all these agencies and churches too. I mean, everybody's got their own congregation, but we're not talking to each other. We're not collaborating. We're not providing wraparound services that would sustain a community.
And John, I think you're absolutely right that collaboration is the key. We've got a lot of resources at our fingertip. Just this webinar tonight is Proactive Community Services and the AIDS Foundation of Chicago and the Illinois Department of Public Health came together to put funds together so that we could create this program for our conversations tonight, which goes into the community to help people realize the effects of HIV amongst the multiple populations in our community and have conversations about how we can get to zero. And the same thing is true when it comes to collaboration around wraparound services for our homeless population. We don't have to provide everything as individuals. One of the things that Faith Church that we do is to have a partnership with PCS and to have a partnership with Respond Now. We have a program at Faith Church called Welcome Home, and our Welcome Home ministry at Faith Church provides baskets of kitchen supplies, mops, brooms, cleaning supplies for people that we give to Respond Now that provides a new place to live for persons who were formerly homeless. So that's our way of participating with another organization that's already doing the work that we can't do, but we can do something. So collaboration with health organizations and mental health services and other places so that we can, refer people within our sphere that we come in contact who need HIV care, who need mental health services and so forth and so on. It has got to be the tool that we use. And then those bigger projects of providing, and I have to chime in and say, I'm another one who's a great fan of SROs, but finding a building and finding someone to manage it and finding an opportunity for us to make that a bigger project is something that we work on also collaboratively, because when we all put our heads together, we can come up with solutions that we can't do as individual organizations or churches or whatever we might be.
Well said. Well said.
Yeah, I'm thinking that, we have the Facebook page. I really want to encourage people because we're coming up to about 14 minutes to end this webinar. Is that if you are interested in supporting John and his effort to not only end HIV epidemic, but to end homelessness, please drop your information either in this chat or go to Facebook and continue the conversation. I think that we need to look at people who have time and want to put their efforts into something like this, to call our friends like Delreese Adams, who's working with ICEJA, and they are the R3 program that's supposed to be addressing the harms done by the over-policing due to the war on drugs. We have mega bucks that are coming into Illinois in the next year or so. That's going to be distributed. There are dollars out there. I think it just takes having a strategy, having organizational structure that can be funded, that then can fund programs for the homeless. So I really encourage you, if you are really interested in ending homelessness and ending HIV epidemic, which have a synergy, they intersect. This is a good time to reach out. Let John know who you are. Let him know what you can do. Go to the Facebook page, have conversation there. But really, this is an ongoing conversation. I really want to thank John for joining us tonight, and thank everyone who's in the audience listening. But and I'm going to kind of quiet down for a minute so other people can have a chance to chat. But please throw your opinion out there. Throw your voice in. Let us know what you can do.
I think I saw Anthony raise his hand. Would you like to speak? I think I've unmuted you now. Okay, if you'd like to ask a question at any point, you're able to. Eula had wrote in the chat that perhaps we can prepare a concept paper regarding addressing homelessness to shop at various foundations and other funders. What do y'all think about that idea?
Love it.
We had a comment too about sort of the nature of how things might have changed a bit at the Y. Eula had written that it seems that the Y focuses more on physical fitness. I'm not sure, but there appears to be a trade-off from community programs to physical fitness. Have y'all noticed that at all with regards to the Y?
I mean, I think when they were making this transition, physical fitness always, it's the sexy trend, right? Everybody feels like that, they can make money in physical fitness and those type of activities. But what the Y was founded on was creating recreational activities to heal the spirit, mind, and body of individuals, right? So I think they kind of switched their mission up and got away from that for, monetary reasons, of course, probably. But I felt like there should have been other agencies to step in. There are boys and girls clubs within, the city of Chicago, but there's not many out here in the south suburbs. Park districts couldn't step in and do so much, but there weren't any other agencies that really stepped up to take the reins of what was such a great program in our communities. So there's opportunity to get that back. And it's actually necessary to get that back, because if we don't create some type of solid foundation to address what's plaguing our communities, homelessness, HIV, mental health, all these different issues that are destroying us right now, employment, job training, I could go on and on and on. If we don't address that need, we'll never get these communities back.
Open the floor now for anybody that would like to ask our speakers if they have any questions. You're free to do so in the chat, or if you'd like to raise your hand, I can give you the floor as well. But we really appreciate everybody for attending tonight. really great to get thoughts from our panelists. John, it's been great too to get your perspective too on homelessness. I feel like I've learned a lot from that too individually.
Oh, thank you. I've enjoyed it, and I appreciate the time. I've enjoyed my work over the last year. I've worked closely with PCS and also with Pastor Strait and his church, and look forward to continuing. And I hope to meet everyone on the panel and that's attending today. And let's get this work done because it's necessary.
We
And a
appreciate
question for
that.
everybody to think about: how many people do you know who are one paycheck or two paychecks away from being homeless? And I think if you really consider that, you'd be surprised what the answer is.
Yeah, and exactly. And per our call center, I think, I mean, it was in the thousands. I mean, they're probably getting calls right now. There's shut off notices that are going out right now, you know, in communities. I see the trucks all over our neighborhoods, shutting water off and the electric off and the gas off. And then those houses are uninhabitable, and then they are deemed homeless.
You know, John, you're absolutely correct. And this is the season for it, right? Because People's Gas and what's the suburban gas company?
Nicor,
Nicor is
Ahmed, yeah.
prohibited from turning off the gas in the wintertime. But as soon as April comes and the weather's a little bit better, that's the time that they turn off the gas. And it's not, if you live in this area of the country, you know that it's not guaranteed that it's not going to continue to be cold for a while. But people do go without those services, and then before you know it, it's the lights and, you know, the next thing, because, you know, the thing is, when you're living from paycheck to paycheck, and I've done it, I know exactly what it feels like.
Yeah.
All it takes is one little hiccup.
Yeah.
All it takes is one unexpected problem, you know, before you can't pay the light bill, you can't pay the gas bill. And you're right, John, who lives in a house that they can't eat or sleep in because you don't have lights and gas, and are unable to pay the mortgage or unable to pay the rent, and you're evicted. And with the eviction moratorium, I hate to imagine what we're going to see in our homeless population going forward. So it is absolutely something that we have to consider, and something that we have to be very, very vigilant about. And I'll say again, something that we have to talk about in churches. We can talk about it in Bible study. We can talk about it from the pulpit on Sunday. We can talk about it in just general conversation. But if we are not addressing the needs of those that Jesus say that when we're not addressing their needs, we're not addressing his needs, then we're not doing our responsibility. We're not doing our job as the people who are called to be God's people.
Amen.
And that responsibility, Pastor, goes beyond giving $1 to the homeless person today and thinking you've done your job. And I think that's where we sometimes miss the true mark of what it is to be a Christian, that it's not just what I gave at the office type model where, you know, I saw a homeless person, I gave him $1, so I'm okay now. It's going to take more than $1 to make a difference in the situation that's facing our communities today.
Well said.
All right, we thank everybody for coming out tonight. I want to remind everyone that we have our webinar same time next week, Getting to Zero, engaging the trans population is next week. So we'll have that with Sahara Bassett next week. So we hope to see y'all there. I'll allow just a little bit longer in case any questions come in for our guests, but we really appreciate having our panelists tonight.
Thank you.
And do you have the poll tonight, Andrew?
I do. I formatted a little bit differently. It'll happen after you close out of this. You'll get it in your browser.
Thank you.
Appreciate you facilitating, Andrew.
A pleasure. It's always great to host y'all.
Yes, you do a great job.
Thank you. We'll allow just a little bit longer just in case any last minute questions somebody's are typing in there, but it's been great having everybody tonight.
And don't forget, you
I
can access the previous sessions of going to our website at PCS.
PCS.
Yep, pcsil.org. If you go to the events and webinars section of the homepage, you'll see all the upcoming webinars that we have, I think over the next 4 to 5 weeks. And if you navigate backwards on the arrows, you can watch recordings from the previous sessions, like Al said. All right. Thanks everybody for attending tonight. We'll see you all next week. It's been a pleasure and see you soon.
Good night.
See you next week.
Good night.